watching Afternoon Live. If the change of seasons intensifies your pain, our next guest has 3 simple ways to alleviate your pain brought on by hot and cold weather. We welcome Dr. Joseph Pergolizzi is with us today. Dr. Pergolizzi, thanks for joining us.
My pleasure. Thank you for having me.
Yeah, we'll talk about the type of pain that people go through with hot and cold weather.
Well, you know, it's not an ideal science, but it's very commonly reported by patients that when temperatures are very hot and the humidity is high, that means you have a high heat index, that they experience different types of muscle skeletal type pain. So joints in the legs and the arms are going to just hurt a lot more. People who have chronic migraines will report a higher incidence and more severe migraines. And individuals who suffer from other neurological disorders also are going to complain from high temperatures.
And it's different things that you need to do, whether it's hot weather or cold weather, right, to alleviate the pain?
That's correct. I can tell you that there are at least 3 ways that you can alleviate or mitigate the high intense pain increases that are related to increases in temperature. One of those is to choose the shade over the sun. That makes sense, you know, move into a cooler place. The next is to stay well hydrated. You know, always carry a bottle of water with you. Wear clothing that is breathable. That's always a really smart thing to do. And if you're out in the sun, what you want to do is make sure you put your pain medication on if you are experiencing joint or muscle pain before your sunscreen, and then put that always important sunscreen on next.
What do you recommend as far as pain medication, like as far as layering it on in creams? What ingredients should you look for?
Sure. You know, a lot of times ingredients that are known to be pain relievers include menthol. So I like a low-dose menthol, particularly nice if you can combine that with a natural oil. Or in one case, I have a product I developed called Instaflex, which is a natural oxygenated oil with menthol, a known pain reliever.
Such a good tip. Okay, and then on the chilly days, because that's what we're getting into now, what do you recommend?
That's really a good question. You know, same thing with those high temperatures. When you get these extremes in temperatures, lots of people will complain of joint or muscle pain as well. So here, you want to move to a warm place. You may want to drink some warm fluids, even add some honey or tea so you get more of a sugar influx into the muscles as well. And this usually is not a bad idea when you're in a more extreme cold area. One thing I do want to mention is that for younger patients, children, if they do experience very high temperature or very cold temperature, even if it seems like the type of symptoms have gone away, it's important to go see a healthcare provider.
At what point should you go see someone?
Great question. You know, if you see that there's persistence, swelling in a certain area, stiffness in your neck, generalized symptoms all around, these are the times that you really want to consider a healthcare provider.
I'm just curious why this happens. Like, why does the weather trigger pain?
Great question. There's actually a science called biometeorology, and I was recently on the Weather Channel talking about it. We're not sure. It could be the barometric pressure, particularly for people who experience joint pain and muscle pain, and these extreme fluctuations in the barometric pressure coupled with extremes in temperature seem to be the triggering factor.
And is it usually, I mean, you mentioned kids, so it's all age groups?
It is. It's all age groups. And just like with extreme weather changes, the extremes in ages. So the older individuals and the younger ones are the ones that we have to be even more cautious with if they are exposed to these extremes of temperature.
Is there ever any other underlying factors or anything else to be concerned about if this is something that makes you have pain, the weather?
Yes, you know, some individuals who have certain neurological disorders like multiple sclerosis, sometimes extreme heat can cause them to even have worse symptoms like loss of vision. So these are the individuals that really do need to understand the consequences related to their existing comorbidities or disease state and manage it appropriately in these extremes of temperature.
And where's any resources? Is there any good resources that you can lead us to?
Sure. Everybody's always concerned about what we call cyberchondria, right? You start to look at the internet and you see all these things and read them. You want to try to get validated information. The major academic medical centers I suggest, like Johns Hopkins, Mayo Clinic, are good places to start. HealthyDirections.com have a lot of information related to natural products, the supplements that people should consider as well. And my website, drpergolizzi.com.
Love it. We're going to link your website to our website. So much information today. Thank you so much, Dr. Pergolizzi.
Thank you, and enjoy the rest of what we have for good weather.
I know. We have a beautiful fall right now. Thank you. All right. We're going to have more information about Dr. Pergolizzi on our website at katu.com. Don't go away.